Well, let's bring in Dr. Lisa Barrett. She is an infectious diseases physician and researcher at Dalhousie University in Halifax. Dr. Barrett, first of all, thanks for taking time to speak with me. I appreciate it.
Oh, thanks for having me.
Look, let's start with the surge in cases across the country and what we're seeing here. How concerned are you about whether the measures being taken in sort of a piecemeal way across the country in various provinces and municipalities, whether that'll be enough to get this surge back under control?
To be honest, I'm a little conflicted about the difference between a federal response and provincial. We know with viruses and any kind of infectious disease outbreak, we need a very regional approach to respond when there are differences in different areas. For example, if there are 0 cases in an area, the same response is not needed as in an area that has 1,500 cases a day. So I do think that the nuts and bolts of a very, very effective response, both testing, tracing, and then the precautions that we need to take have to be very regional and appropriate to the outbreak. However, if there's not federal support to allow people to be able to do the public health things they need, and by that I mean financial support and an overarching direction to the premiers that's consistent, I think we do have a problem. So I think the federal response has been okay to date. I think everyone in Canada would be also okay with it if they were a little more forceful. And then at the provincial level, in certain parts of the country, we really need to have a more definitive approach and a more aggressive approach that's based on virus, not politics and not economics.
Well, some experts, as you know, argue for another full short-term lockdown to try and flatten this curve quickly. Everyone stays home, almost everything shuts down until the numbers are better controlled. What's your view?
I think that in certain regions, that's absolutely necessary. If I were to look around my own province, we have parts of Nova Scotia, for example, despite our quarantine, when people come in after travel, we have certain parts of our province that really are starting to see case numbers go up. And I would much rather see a short-term, early, definitive introduction of very limited socialization at this point than wait until the virus has gone further. Because really, not to talk biology on a politics show, but the biology of this virus is different. People are infectious when they don't have symptoms and they're out moving around. And that's why, with 14 days of asymptomatic spread, we have a major problem if we wait until the cases go too high.
We saw the Atlantic bubble burst today effectively with PEI and Newfoundland and Labrador implementing restrictions for people traveling to their provinces now. Is that the right move, do you think?
Yes. If I were them, I'm a Newfoundlander. If I was sitting in Newfoundland right now or PEI, I think that's a great piece of leadership on their behalf. They're not saying they're not going to come back. They're not saying they're leaving the bubble forever, but they are being very strategic about controlling virus early so they don't have to use all of their healthcare resources in public health on tracking and tracing. Keep the numbers low, keep the controlled border, and I think that makes sense for 2 weeks given the rest of our Atlantic bubble at the moment.
Lots of questions in the House of Commons again today about testing and rapid testing and its availability in this country. The federal government has deployed more than 4 million rapid tests to the provinces, but many provinces and municipalities have been slow to use them. You were in the Halifax community, I know, Saturday night administering rapid tests at Nova Scotia's first rapid test site. Still lots of questions, though, about their reliability. So how should they be used and what can they tell us?
Right. So this rapid test is not quite as sensitive. And by that, I mean at certain points in infection, you can miss a positive with this antigen test. But that's okay if you're asking the right question. And what I mean by that is probably not the time or place to be using this kind of test in people who have symptoms or are at high risk already, contacts of people or people that have been in an exposure site. However, if you want to get an idea of how much virus there is in the community around you when this virus doesn't have a lot of symptoms, this is a perfect test. It's quick, it's fast, it's pretty easy to use, and you get results in 10 minutes for people. And then you're not walking around making policy decisions blind to the actual number of cases in your community. Okay. Don't forget, all these colors that we see across the country are based on the number of cases per 100,000, and no one's testing asymptomatic people, so we don't know what the heck is going on.
Right, so in your view, should the provinces be, there seems to be delays in the provinces putting these tests to use. What do you think of that?
I think there's a really, really good case to be made that in situations where people are out in public and they're, for example, here in Nova Scotia, our bars and restaurants are still open with some restrictions, but they're open. So if you're going to have social COVID living type of situations, when virus levels go back down to a reasonable level, you're going to have to find some way of testing people until we get vaccines out and rolling. And these antigen tests, I think, would be a great adjunct, but only once these groups and places get their virus levels somewhat under control. Until then, I still think you can't test your way out of an uncontrolled pandemic. You've got to bring it under control first, then bring in the asymptomatic testing.
We got more good news on the vaccine front today with AstraZeneca announcing its vaccine is at least 70% effective. Canada has pre-ordered 20 million doses of that particular offering, and it has this one has the added feature of not requiring the ultra cold storage requirements. So how significant is that feature of this vaccine, and in terms of what this offers in terms of deployment and use? Could this be a big game changer?
Well, I think to your point, there's logistics and then there's how well something works. We need a number of vaccines to come to market at the same time. We know that all of these vaccines work in clinical trials, but we don't really know yet how well they're going to work in the real world. So having multiple options is really important. And also, it's important to have different types of vaccines. This one is a live virus, even though it's not the COVID-19 virus, but there is live virus that delivers the antigen into the vaccine. So what I mean by that is that it's not always appropriate for people with compromised immune systems. So some people won't be able to take this one, whereas with the other Moderna and other Pfizer vaccines, they probably would. So good to have multiple options. Great that it doesn't require a cold chain that requires us to buy very, very specialized freezers and have them made in time. So excellent to have multiple bits in the toolbox.
Just quickly to finish up, how confident are you that the federal and provincial governments will have in place appropriate vaccine rollout plans when the time comes to distribute these vaccines?
Well, I see a lot of promising activity and behavior. The Canadian Vaccine Task Force has really spent a lot of time thinking about the things we need nationally and making sure that the needles, swabs, et cetera, are all available to roll out to different spaces as we need it. We also, compared with some other countries, have a pretty good system of rolling out other vaccines across the country pretty quickly. For example, the flu vaccine, although it's managed at the provincial level, we do it pretty well. So I think in combination with that and the fact that many provinces are putting together special task forces and groups to roll it out, that's promising. Now we just need to make sure that we actually resource those task forces properly to let them do their work.
All right, Dr. Lisa Barrett joining us from Halifax. Thank you so much for your time.
Thank you.